Hi, my name is Chris. Today I'm going to be going over GOG 157, which is looking at 3 cycles versus 6 cycles of chemotherapy for patients with early stage epithelial ovarian cancer of unfavorable histologies. So in brief, when we break down ovarian cancer, there's like the 3 main categories, which is like epithelial, then you have stromal, and then you have germ, and then with inside the epithelial, you have your subcategories for like serous, mucinous, endometrioid, clear cell, and transition. And so that's just like kind of just general. You can look at the picture right here. And so some backstory for GOG 157 is that the 5-year survival for these patients with unfavorable histology, which I'll go into, was around like 25 to 40%. 5-year overall survival, and then they ended up giving IV FOS to these patients that increased their OS to around 80%. And then when they were looking at IV FOS, they then compared IV FOS to cisplatin, and then with cisplatin, they ended up knowing that there was a decrease in the recurrence in patients with having this specific type of cancer. And there was a big Italian study that came out that showed that cisplatin also reduced the recurrence rate around 60% compared to IV FOS. So GOG ended up coming out and saying platinum-based chemotherapy should be used for these patients. And then in conjunction to that, then there was another study that came out in 1996, which was showing that when you're using doublets, which was cis and Taxol, ended up having a favorable profile with overall survival as well as PFS in those with stage 3 or stage 4 advanced ovarian cancer. So then the standard was going to be Carbo and Taxol. Cool. But now the question was, how many cycles are you going to be giving? So first for this, there was going to be either, for advanced stage ovarian cancer, they could either be doing 6 cycles or more than 6, which is like 8 to 12. And there was a study that showed that there was no benefit beyond 6 cycles. So that was the recommendation. But for patients with early stage ovarian cancer, the duration of cycles was unknown. And thus we have GOG 157. The primary endpoint to this study was going to be recurrence rate when compared to 3 cycles versus 6 cycles of carboplatin plus paclitaxel, and that Taxol was given at 175 for 3 hours, and then Carbo was given at AUC of 7.5, and that was redosed every 21 days. For the inclusion criteria for histologies, you're gonna have your stage 1A grade 3s, your stage 1B grade 3s, any 1C, or a stage 2, or any clear cell. So next is the study design. So this was a randomization 1-to-1 within 6 weeks after laparotomy, and they were either going to be put into this 3-cycle or the 6-cycle arm. And then this is the diagram that shows right here. So an important thing for this is that all the patients needed to be completely staged, or that was the recommendation, and complete staging was going to be total hyst, a BSO, resection of all gross disease, aspiration of free peritoneal fluid, peritoneal washings, and infracolic omentectomy, selective bilateral pelvic lymph node and para-aortic lymph node dissections, as well as peritoneal biopsies from 4 pelvic locations and bilateral paracolic area, as well as a right diaphragm cytology or biopsy. And that was defined as complete staging. So looking at Arm 1, there's a total of 213 patients, and Arm 2 at 214. But out of the Arm 1, 58 did not meet complete staging or had incomplete documentation, whereas around 68 were in Arm 2 that also didn't meet the complete documentation. So these patients were enrolled between 1995 and 1998, and here are the big findings for the paper. So I'm showing some of these figures right now to you, but in general, we're looking at overall recurrence rates. So for stage 1 versus stage 2, the overall recurrence rate was 18% for stage 1 and then 33% for stage 2, with 5-year survivals for stage 1 at 84%, and the 5-year survival for stage 2 was at 73%. Then that was for our entire cohort for our paper. But then when you're looking at 3-cycle versus 6-cycle, the overall recurrence rate was 25.4% for 3-cycle and then 20.1% for the 6-cycle. And then when you actually look at those that had complete staging, that difference was 23% versus 20% in the 3 versus 6 cycle respectively. So the breakdown of the paper was that 6 cycles technically had a 24% less recurrence, but that hazard ratio was 0.76 and crossed 1, so that was not significant. And then when they looked at death rate, 6 versus 3 cycle also had a hazard ratio that crossed 1 as well. So this led to the recommendation from GOG 157 sharing that in patients with early stage epithelial ovarian cancer of unfavorable histology, when looking at 3 cycles versus 6 cycles, the addition of 3 cycles led to a non-statistically significant reduction in recurrence rate, but increased the rate of toxicities in those patients, thereby leading to the recommendation of giving patients 3 cycles of carboplatin and paclitaxel. The more you know.